There are two modes within ACTIVSim Nursing. There's the coach mode, where your coach will walk you through how to navigate throughout ACTIVSim Nursing and also how to care for your patient. There is also the practice mode, where you are not given any assistance and you must care for your patient yourself. We're going to now take the practice mode. Now you will choose which nurse you would prefer to be in the simulation. From here, you can reference all of your patient's background information. You can check the medication administration record simply by clicking on it. You'll notice there are dosage times and the date with the shift nurse's signature. We can check our patient's chart. Please note that there are scroll bars here within the chart, within our procedure history, and also our physician's orders on the right-hand side. The last item here is our shift report. We have all of our patient's vitals here, and we are using an S-bar framework. The shift report also tells us that for this simulation, we will be entering the room at 8:30 a.m. From here, we just click Go See This Patient to enter the simulation. Once it's ready, the orange Next button will appear on the lower right-hand side. From this screen, the coach is just giving you an overall briefing about the simulation, some things to remember as far as your communication and the patient's disease process. Please note that you always need to do a full assessment on each of the patients within ACTIVSim Nursing. We'll click Next now. We'll see our shift report once more, and now we can enter the simulation. You'll notice on the upper right-hand side, our local time is going to continually run throughout the simulation. Just below that, we have an Equipment and Actions menu. Each box here is a new menu. When we click on these boxes, they open up and show us options for assessment and implementation of care. You will need to navigate throughout each of these menus and choose the options that you'd like to take. On the left-hand side, you will see our pulse oximeter and the automatic blood pressure machine. You can connect those simply by clicking on the boxes to the right, and you can also silence the sound using the speaker to the left. When they are connected, they will show your patient's vitals in real time. They will adjust in real time as you care for your patient as well. Below that, we see two options here that we can click on. Nursing Diagnosis, which contains our NANDA diagnoses. You simply click to document NANDA. Within ACTIVSim, there is no Save button. When you close out using the X to the upper right-hand side of a menu, everything will automatically be saved. You will need to figure out which NANDA diagnoses you need to document. The other item here is our Document Care. This is our electronic health record for ACTIVSim Nursing. We have all of our key findings in here as tabs across the top. So you can simply navigate between the tabs. You will need to document your key findings within here and also your vitals. All of this will be graded, and you will need to input the correct vitals that you obtain in your assessment. You can also access the I&O table from here, and you can also document your patient's reassessment here. You can also pull up the morning shift report, lab results, and the medication administration record. You will also need to sign your initials. Now again, everything will automatically save here. We could simply click Close or use the X at the upper right-hand side. As you scroll over your patient, you will also notice there are some quick and easy ways to take certain assessments based on where your mouse is located. Lastly, for our patient, we can communicate. We do that by using keywords. So rather than type out complete sentences, we can just use keywords. If we wanted to ask Henry if he was coughing, we wouldn't type, "Have you been coughing?" because it takes too long. We want to ask about his cough, so we'll simply input cough. We can choose which question or statement we'd like to make to our patient.
Any coughing? I always cough.
Continue to communicate with your patient and make sure you're asking them all the necessary questions. As I type in my keywords, I can use my mouse to scroll over and select the question or statement I'd like to make. But I can also use my keyboard and just select the number associated with it.
Tell me about your cough.
Sometimes clear, sometimes yellow, depending on how bad my COPD is and if I've got pneumonia.
You can go through each of the menu items in your Equipment and Actions tab. You see the orange button that says Back to Main. You can click on that to go back to your home menu. Navigate through all of your options here. It may take a little while for you to easily find where everything is located. In our breathing menu here, you see that we can check Henry's breathing. And here you'll actually need to start a stopwatch and then count Henry's respiration, indicated by the blue bar rising up to his lungs. Once you have this figure counted, you'll need to go ahead and document that. For auscultation, your mouse controls where you listen to Henry. You may get bowel sounds, lung sounds, or heart sounds. You can also switch the posterior. To give Henry oxygen, we can choose the nasal cannula or the non-rebreather mask. When we do that, you'll see a slider bar appear on the left-hand side that we can drag to wherever we like or use the plus and minus arrows to adjust the level of oxygen we're giving Henry. Take a look through each of these menus. Your first time within ACTIVSim, get comfortable understanding how to navigate throughout the program. Your first time in ACTIVSim, take a look through each of the menus here, just so that you can see where everything is located and what you may be asked to do. If you ever feel lost about what to do next, come to your documentation menu. In there, you can pull up the learning objectives that you previously saw, and that should give you a good idea of what's expected of you. You can also pull up your patient's chart, the shift report, and a good hint is to come into your documentation menu. You can take a look at all of the pieces in which you can document. That can give you a good idea of what assessment to take next. When you are finished caring for your patient, you will click on the green button on the lower right that says End Patient Encounter and go to Debriefing.